I'm very pleased to be here to talk about research and evidence-based practice and how it impacts on occupational therapy. Research, of course, in the last 20 years has played an extremely important part in clinical research and occupational therapy. So let me start by talking about how research and evidence-based practice has impacted clinical practice. Okay, first of all, understanding evidence-based practice. Evidence-based practice refers to the current best evidence to occupational therapy clinical practice for using a systematic review of research or a meta-analysis where data are statistically combined. What that means is that right now in occupational therapy, we have a number of studies, pretty much random controlled trials, and even studies that have to do with prospective designs in terms of research. This is playing an extremely important part in the development of occupational therapy. Now, why is evidence-based practice so important for occupational therapists in the 21st century? First of all, it increases the quality of the clinical intervention so that practice is going to depend upon the research quality. It creates a database in terms of teaching. So as we teach, we use research studies to support what we teach. It integrates recent clinical evidence into practice so that if a therapist is working with a child with a diagnosis of autism, we want to know what is the most recent evidence to support, say, if we use Jean Ayer's work on sensory integration, what research can support the use of SI, or sensory integration, in working with children. It facilitates the transfer of knowledge, essentially, from research to practice, and provides data for justifying a clinical procedure to clients. So that clients may ask, why are we using a specific clinical procedure? We can say, well, there's evidence to support it, such as mirror training and physical disability and other procedures. And very important in the United States, especially in assisting in documenting evidence for insurance payment. So what are examples of best evidence in occupational therapy? As I mentioned, random controls trials is now the gold standard for research. Random controls trials means that we have a study where we have variables controlled. We have what's called a prospective study that has pre-testing and intervention and then post-testing. This is extremely important and used in terms of evidence-based practice. So prospective studies are studies which go forward from the time when we have a pre-test, intervention, post-test. That's a prospective study. Retrospective study of single subjects would be if we're going to find out what are the factors which lead to a stroke in an individual. We'd have to go back to retrospective studies and show variables such as diet or exercise or stress as factors or cholesterol, high cholesterol, in the history of the patient in causing a stroke. This is retrospective. We go back into history. Then there's the longitudinal studies of interventions, because some studies you may have an immediate type of improvement, but does the improvement go on for a longer time? That's extremely important in doing follow-up studies of intervention. Then we have correlational studies looking at the variables to determine whether certain variables have a high correlation, meaning that when one variable goes up, the other one does, such as looking at perception and the concept of being able to distinguish faces, say. So this is especially important in pediatric studies. And then examples of best evidence is in methodological studies of instrumentation. What are the most reliable and valid tests to measure outcome? Then in terms of developmental studies, we do want to find out how children develop and what is we consider to be normal development, and what is then we consider development which is not on the same level as the average child. And of course, then we do client surveys to find out client satisfaction and how satisfied they are with a specific intervention. Now, in terms of occupational therapists, what are the important skills needed to utilize evidence-based practice? One is a critical and objective attitude towards one's own practice. So that science is extremely important in that we're objective, in that we allow any type of intervention to be considered. We're not into one intervention or one intervention fits all treatment. It's very important that we consider all types of interventions, and science gives us that information. Intellectual curiosity and staying current, the clinician should be able to use PubMed.com, which is the Library of Medicine in Bethesda, Maryland, which has millions of studies in a database. So the clinician should keep current with what are the best studies occurring now. The understanding of research methodology and statistics in order to understand the validity of a study, extremely important. Familiarity with, I just mentioned, PubMed.gov and Cochrane reviews. Cochrane reviews are systematic literature reviews of pretty much random controlled trials and perhaps even quasi-experimental designs. The ability to systematically analyze published literature. So the clinician, it has to have the skills to be able to determine, even if the literature is published, it doesn't mean that that this study now is going to be applied. The clinician or the consumer of research has to be able to understand when a study is valid and the reliable results. And the last one is the ability to transfer the research findings into your clinical practice. Now, let me give examples of occupational therapy interventions related to evidence-based practice. Ergonomics and adapting home environments for those with disabilities. All of us agree in occupational therapy that ergonomics is an extremely important part of what we do as an occupational therapist. So if we look at, from PubMed, we would look at what are the studies which show how ergonomics is important in adapting home environments. The application of purposeful and meaningful or occupational activities in treating individuals with mental illness. And that, I think, is very important when working with individuals with diagnosis of schizophrenia or depression, is how does purposeful and meaningful activities help the individual to cope with their mental illness? Teaching activities of daily living to individuals with disabilities. ADL is another important part of what we do as occupational therapists. So in terms of intervention, how does ADL, and using evidence-based practice and research, how does ADL help a person with a stroke now to cope with that disability? So helping an individual with a stroke to be able to feed themselves, to dress themselves, to groom themselves is very important. And we as occupational therapists do an extremely important part in helping individuals who have had a severe disability to become independent. Another aspect is applying sensory integration. We know there's been a number of recent studies to show that SI is effective with children diagnosed with autism, and SI seems to be effective in helping those children to actually learn better. And another aspect is developing splints for individuals with hand disorders. So hand therapy, which is another extremely important part of occupational therapy. Another aspect is adapting the wheelchair for efficient use. So how do we have the wheelchair for a child with cerebral palsy and being able to adapt that wheelchair to make that child as functional as possible? So that's, in a way, is a custom design of a wheelchair. So these are interventions that need research and need evidence-based to begin to apply it. Evaluating assisting individuals with disabilities to drive. How do you help a person who's had a stroke or a person who has an amputation to be able to drive a car, so that we have in occupational therapy hand controls that don't depend upon being able to use your lower extremities. Improving handwriting in children with learning disabilities. This is another area that occupational therapy is extremely important. Implying constraint-induced movement therapy with individuals with hemiparesis. We know that constraint-induced movement therapy has been effective with helping those with a stroke to begin to regain function. So these are all important aspects and for research. Another is in individuals with dementia. Occupational therapists playing a very important role in helping people with Alzheimer's disease to at least maintain their cognitive function, so that memory is extremely important. Assisting a new area that occupational therapists are beginning involved in is helping individuals with diabetes function effectively. One of the aspects of helping a person with diabetes is an exercise program, a nutrition program, and also stress management. We know that all of these three factors are going to increase the cortisol level in people with diabetes, so that occupational therapy will have an extremely important part to play. Evaluating stress and applying stress management programs. This happens to be one of my areas of research interest, and we know that stress plays an important part in almost every single illness. What it does is plays a part as the trigger to individuals, such as a person with multiple sclerosis. When a person with MS has severe stress, that could cause an aggravation of symptoms. So that how do we help a person with MS to reduce stress or to manage their ability to deal with anxiety? And using biofeedback, we know that there are many individuals who become incontinent because of medical prescriptions, and biofeedback happens to be one of the interventions that occupational therapists use. Another aspect is using prescriptive exercise programs with a number of individuals. It's used with people, all they're ranging from depression to people to prevent a secondary stroke, to cardio rehab programs. We mentioned diabetes. How do you prescribe an exercise program based on the intensity, the length of time the exercise is, and the meaningful exercise for the individual? Stimulation programs for infants in neonatal units, extremely important, especially with children who are premature. and teaching how to use prosthetic devices, important now with, especially in the United States, with veterans coming back from Afghanistan and Iraq who have lost a limb. Fatigue management with individuals with multiple sclerosis. All of these occupational therapy interventions are areas of research and important in using in evidence-based practice. Now, in looking at some of the databases, I have just identified a few, and one of them is OT Seeker. OT Seeker is specifically related to occupational therapy research. It's a database for systematic reviews that was established in 2003 and contains over 7,400 studies relevant to occupational therapy. The important journals which are in Medline is the American Journal of Occupational Therapy, the Canadian Journal, Physical Journal, Australian Journal, all of these journals. Now, the Annals of International Occupational Therapy is not presently in Medline, but I hope it will, since I'm the editor of that journal and we just started. So there's a number of occupational therapy journals that a researcher can use. Now, in looking at a research study, there are a number of components which I would use as a researcher and a clinician should also be aware of. One of them are the aims of the study clearly stated. Are the conclusions in the abstract justified? Is the literature review current, objective, and complete? Can the methodology be replicated? Are the outcome measures reliable and valid? Or are statistical methods correct, and are the results accurately presented? And then what are the clinical implications of the study? When a clinician looks at a study from a database such as PubMed.gov, these are the questions that the clinician would ask in terms of, is this a reliable and valid study? Now, it's also the same questions that as an editor of a journal, I also ask when to see if this research is reliable and valid. And how do we apply research to evidence-based practice? We first identify a specific disability, for example, autism. We implement the literature review. We set up a screening criteria. We operationally define the intervention. We select a reliable and valid outcome measure. And we apply statistics and integrate results with published literature. And then we transfer results. So as I'm talking about this, I'm going through this very quickly, but what I want the clinician to come up with, and the researcher, is that evidence-based practice, clinical research, and clinical practice are very much hand in hand, and they work specifically in reinforcing each other. As the clinician uses evidence-based practice, perhaps the clinician then comes up with other studies, which then encourages clinical research. So what are potential research questions? One of them is sensory integration effective assisting children with autism to be independent in ADLs? Is constraint therapy effective in improving gross motor function in individuals that have stroke? Are service dogs effective with people with physical disabilities and increasing independence? These are studies, these are research questions where clinicians are currently involved in. Now, again, transferring the results to clinical practice. I have said this before, are the results studied, reliable and valid, consistent with findings from the literature review? Is there an operational definition independent variable? What I mean by this is that if a researcher or a clinician does an intervention, can another researcher replicate that intervention? Can the outcome measure be applied in practice, and how can the specific results be applied? So, in summary, Occupational therapists should understand evidence-based practice because it is a systematic method to incorporate the most current and effective interventions into practice. And that is my conclusion, and that is my study. Thank you, and I appreciate being able to be involved in this symposium.